everybody. It's Dr. Jerisa ER coming to you today with your tips for the ER trip. I'm Dr. Jerisa ER, board certified emergency medicine, and I help burnt out, stressed, anxious patients in emergent health conditions. You will leave relieved, healthy again, and back to baseline. Today, I'm so excited to bring you some tips that perhaps you could use to share and maybe even avoid going to the emergency room. I'm actually not at the emergency room today. I'm at Vital Care Medical Center, which is owned by my husband, myself. We treat a lot of primary care patients here. And the reason why I wanted to come here today is because we actually experienced a loss this week with one of our staff members. Hi, good to see you, Dr. Dre. We actually experienced a loss this week with one of our staff members. She was involved in a very, very serious car accident. And it wasn't her fault. The guy just ran the red light and T-boned her, kind of hit her on the side. And it's unfortunate that we're experiencing a loss now. We're seeing a lot of car accidents. You know, everyone's busy now. Everyone's, doing the holiday shopping, and it can be kind of hectic right now. And so we are seeing a ton of car accidents. And so just be careful. When you're out there, make sure you have your seatbelt on. We had a very unfortunate car accident this week, fatal actually, with a young man. He was in the back seat. Seatbelt wasn't on. So make sure, even if you're in the back seat, that you have your seatbelt on, because you never know. It doesn't have to be your fault. You could be the perfect driver and someone else just comes and your life is just taken for a turn, So car accidents, the number one killer, okay? Unfortunate. The number one killer in young adults. So be careful when you're driving out there, when you're with your friends, okay? Very, very careful. Moving on for car accidents, so I'm really excited to share this next tip with you, because it could absolutely potentially save you an emergency room visit. When you're around someone who is, it's very sad. We've seen a lot of car accidents, Dr. Jared. Hi, Dr. Jared. When you are around someone and they're choking, you're with your family, your friends, and next thing you know, you're eating, you're laughing, you're having some eggnog or something, and the next thing they do is they're choking. The first thing you want to see is, are they talking? Are they able to talk? Okay, if they cannot get any word out, you need to try to do something immediately to help them. Of course, have someone call 911, but what you can do also is get behind them. You have your fist balled like this. You put it underneath your rib cage. And some people get confused because they think, you just go straight back. You don't really go straight back. What you want to do is what we call a swooping motion. So it's straight back, but it's also up, okay? And you're doing that right there underneath their rib cage. So straight and up. That's what you really want to do. And you may not be successful the first time. Some people say, oh my gosh, I did it once. So what do? Do it again. Keep doing that same motion. In and up. In and up. It's like a swooping motion. Okay. And we've got a little girl. She's so cute. So definitely do that and keep doing it. Now that's if they are not talking. If they're, you see them choking and they're not talking, then definitely hurry up, get behind them and do that. What we see a lot in the emergency room is patients come in and, they feel like they got some food stuck here. So they were eating, some steak or shrimp or something, and they might not have chewed in enough. And so it just kind of got stuck here. Or they feel, what we call a food bowl is stuck in these areas. And so those patients are usually able to talk and they're telling you what's going on. So that means their airway is not compromised. Okay. Hi, Tony. Good to see you. Thanks for joining. So what you want to do in that case is, that's where I mentioned the Coke and Pepsi. Now you'll be surprised. I actually was surprised as a medical student when I witnessed this happen. But believe it or not, although those are everyday beverages, Coke and Pepsi, what you want to do is, and what we've seen in the emergency room in the hospital often is, when people come in, nursing home patients come in, they have, unfortunately, a feeding tube. And their feeding tube is where, of course, the food goes through. And sometimes, a lot of times, actually, it gets clogged, okay, or occluded. And when they come to the hospital emergency room, the first thing we do, you can even ask a nurse, what is the first thing you do when someone comes in with a feeding tube that's clogged? What we do is we get the highest carbonated beverage, whether it's Coke or Pepsi, and we flush that tube. and within 30 minutes, the tube is working. And so a lot of times when someone has, some food that's stuck here, I actually saw one time in the emergency room I worked one night, and there were 2 patients that came in that one night with that same complaint. They tried to drink water, and the water wasn't helping. You think, well, you're going to try water, and you're thinking that it's going to soften the particle, and it does. But what you really want to... Hi, Dr. Michelle. Hi, Tony. Good. I'm glad you're enjoying this and seeing it as beneficial. What you really want to do is take, Coke or Pepsi, and I'm not going to say which one is a preference. I actually do have a preference. Are you Coke or Pepsi? I have a preference, but it doesn't matter which one, as long as it's, kind of one of those two. Start drinking that, and it helps to digest that food particle. And I know that's an everyday drink. Some people drink that, those beverages with all the time, but specifically, that's what we use in the emergency room, in the hospitals, to help unclog a feeding tube. And if you start that at home, you could potentially avoid coming to the emergency room. Of course, you come to the hospital, we're going to give you shots, we're going to give you IV medication. We have other remedies for that. But keep in mind at home, if you have some Coke or Pepsi, and not the 2-liter bottle, not the one that's been open for a week, because it's not as strong. You want to get the can that's fresh open, pop it, and start to drink that. And it helps to digest and dissolve the food. Okay? So that's what you could potentially do when you have a food bolus stuck in this area. All right? Moving on, I want to share a couple other emergencies with you that we see commonly right now. We're seeing a lot of lacerations. A lot of people are cooking, they're opening the gift box. Hi, Dr. Michelle, and they are, sometimes you're doing things quickly and you accidentally get a cut. Okay? So a lot of people struggle with, when do I go to the emergency room for a particular laceration? Is this cut big enough? Is it deep enough? So we see that a lot, and it's unfortunate. I know it can be a tough question to answer yourself. So when in doubt, go to the emergency room, because the worst thing you can do is wait. The worst thing you can do is wait the next day. And when you come to the emergency room, unfortunately, for a lot of lacerations that are older, for example, longer than 12 hours or 19 hours or 24 hours for the face, when they're longer, a lot of doctors are not going to really repair that wound. And it's going to have to heal naturally, which a lot of times when it heals naturally, it can cause scar, and it can just be a slower time for healing. So if it's a really small laceration and not as deep, and your tetanus is up to date, then you could potentially avoid going to the emergency room. You may want to, stop by a drugstore and try the Dermabond or the Steri strips that they have over the counter. If it's deep and if it's long, you need to come to the emergency room and have us evaluate that and potentially stop the bleeding and allow for a better wound approximation, what we call it, or just wound healing, so that it reduces scar potential. One other trauma that we see a lot around this time are burns, because again, people are cooking, and a lot of times you can be distracted if you have your family around, your friends around. Be careful, but there's different type of burns, and the burns are the same way. And the first thing you want to do if you have a burn, it really depends on how the length of it, how big it is, and also how deep it is. The first thing you want to do, one of the first responses, you want to rinse it. And I know it can be very painful. Burns can be very, very painful. So if you're in pain, come to the emergency room, because we can absolutely address that. But you also want to potentially try to clean it with rinsing it under the faucet. And also, if you have some ointment, bacitracin, polysporin, neosporin, whichever one you prefer, apply that and then cover it. Now, certainly if you have a burn to your palm of your hand, your feet, if it's a long, extensive burn, then you just need to come to the emergency room and have us evaluate that. Hi. But those are some of the kind of the 3-4 common emergencies that we're seeing a lot of now. I have got to run. Thank you for tuning in. Until next ER tip, you guys enjoy your holiday. Be safe, drive slow, watch out for the other person, okay? I'm Dr. Jerisa ER. See you next time.